am Ashley Jones, Communications Director here at the Calhoun County Area Chamber Visitor Center. And today we are joined by Marty Weiss, who's the Director of Sales and Distribution for Iron ReHealth. And he's going to talk a little bit today about what they offer as far as health benefits for affiliated chamber members. So Marty, if you would like to go ahead and get started.
Well, thank you, Ashley, and thank you for those that tuned in either live with us or will catch it later. But I'm with Iron ReHealth, like Ashley mentioned. My name is Marty Weiss, and I'm the Director of Sales and Distribution. Iron ReHealth has partnered with the Chamber of Commerce Association for the state of Alabama, which the Calhoun County Chamber is a member of, and we've partnered with them. We started this partnership in March of 2019, and it's really just to provide health benefits to chamber members, whether that's a group of business of 2 employees or a business of 500 employees. But it's tailored to small and mid-sized businesses, and by coming together, we can help kind of mitigate some risk and offer some better benefits than what you might currently be offering in the small group format that you're in now. But we've had a lot of success. A lot of chambers have partnered, and we're glad to offer it through your chamber. So as far as the program eligibility, like Ashley said, you need to be a member of the local chamber. So if you're already a member of the Calhoun County Chamber, or you're thinking about becoming a member, you can go through the quoting process. If you want to go through the process without being a member, that is fine. But ultimately, if you want to join the health benefit program, you will have to be a member. So I'm sure Ashley and her team can help you out with that with no problem. Employees, as far as qualifications, you have to be a full-time employee, and that's considered 30 hours or more per week. So you have to average that. You don't have to work that every single week. So if you work 24 one week and 36 the next week, as long as you average 30, then you are eligible. Company must have 2 employees or more to apply, and 2 or more actually have to go forward with coverage. Those 2 employees can be a spouse, so a couple. So if you're a husband and wife, you're both full-time employees, you would qualify for this. If you have a father and a son that are both full-time employees, and that son needs his own benefits, meaning that he's older than 26 or older, then that would count. So we can quote anything from 2 up. Unfortunately, at this time, independent contractors are not eligible, so you must be a W-2 employee. But this program is for 2 as large as you want to go. I mean, we have some employees, some employer groups that number 1,000 plus for employees on the plan. So it doesn't matter how big or how small you are, we can accommodate any group. Some of the program features, we utilize the Viva Health Network, and Viva Health was created by UAB in the mid-90s. They have expanded their health network ever since. There's a common misconception out there that Viva is only for UAB hospitals and UAB providers, but that is not true. The network is very large. It's very nice in your area. I looked earlier at the Calhoun County area. I looked at the Etowah County area and saw that there's over 700 or 800 providers just in those 2 counties alone. You have all the major hospitals in your area. You have your local hospital there in Anniston. The Northeast Alabama Regional Medical is there. You have Stringfellow as well. In Etowah, you have Riverview Regional. You have Mountain View. You have any hospital in the state is covered in this network. So there's an abundance of urgent cares in the network. So it's a very robust network. We've also, in addition to Viva, we've added, because Viva primarily is the network is located in Alabama. They have about 1,000 providers outside of the state, but it's mainly in Alabama. So Iron ReHealth has added the PHCS multi-plan network to pair with Viva. And that is a network that can be used in Alabama as well, but it's also can be used out of the state of Alabama, because it's a national network. It's got 700,000 providers nationwide. So if you want to go see someone in Georgia or Tennessee, we've had multiple members in the program, ask questions about going to see a doctor at MD Anderson, Houston, Texas. They're in the PHCS multi-plan network, so you can go see them. So it's nice. I mean, if you're on, if you have an elective surgery in Tennessee, or want to see a doc in Tennessee, then you can use that network as long as your provider is in that network. So, one common question we get is, well, what about if I'm, out of town with work or on vacation or whatever, and I get hurt or I get sick? Well, emergent care or urgent care is covered at 100% regardless of where you are. So if you're skiing in Colorado on vacation and break your ankle, then that's considered an urgent or emergent situation. So you can go anywhere. If you're out of town with work, and so all of a sudden you think you have flu-like symptoms or whatever it may be, you can go to an urgent care. And even if it's not in network, it's an emergency situation, so it's covered. So we added that network in addition to Viva. So we have the Viva network, we have the PHCS multi-plan network that helps with in and out of state coverage. And we've also recently added, Viva has partnered with NAMC, which is North Alabama Medical Cares network. So that network is really popular in North Alabama. So you might have members that are in your chamber that have employees that live north of Calhoun County, where this network is really large, and they could possibly have a provider that's in that network. So we've got all three of those networks to utilize. So that's one really big benefit we have. We've also added Teledoc as a $0 copay feature in this program. So that's been really helpful, in 2020 when when this pandemic started hitting, and, people started being more reserved about going to an urgent care if it wasn't flu-like, or if it wasn't COVID symptoms. If it was something simple as an ear infection or sinusitis, people have taken advantage of Teledoc by just calling that 1-800 number. You talk to a Alabama-based physician. It typically takes 5 to 7 minutes. That's either a phone call or a FaceTime conversation, and it's kind of just like your first line of defense. So you can talk to them first, and if they can diagnose, the simple sinusitis or ear infection, they can call in your medication to the pharmacy. You go pick it up. You don't have to go, sit in that urgent care facility where there's somebody that's probably, sicker than you are. You don't have to wait for 2 or 3 hours sitting there, and you don't have to find somewhere for your children to be while you're waiting there. They don't have to go in there with you. So it's been nice. It's been a nice feature because there's no cost to that. There's no copay whatsoever. We also have Smart Health 360 benefits, a wellness program, and one of those features, we have a prescription savings program, which we rolled out in June of 2020. And that has helped save a lot of members copays that they were paying, whether that's a lot of it is either a tier 3 drug or a tier 4 drug, or a specialty medication, where right now they might have a $65 copay or $100 copay or even higher for a specialty drug. But if one of those drugs, and it's not just tier 3 or 4, thank you. It's not just a tier 3, tier 4 specialty. It can be any type drug. But if you come on the program, we have a nurse, a health advocate, that after you're on the program for a month, she will see all the medications that new members are on. And if you qualify for this benefit, she will reach out and tell you, hey, I see that you're on this tier 3 drug that's costing you $65 copay per month. If you're willing to let us mail this to your house, then we'll waive your copay. So we've had a lot of members that are excited about this because, if you're on a $65 copay and you can waive that, that's $750 or so a year in copays that you no longer have to pay. So it's been a nice benefit, a nice addition to the program that people have really liked. We also have an additional customer service team. So on the back of your card, you're going to have the information for Viva to call their customer service team. But we also at Iron ReHealth, we're based in Montgomery, and we have a local number. It's on the bottom of this screen. It's 334-245-1099. So if you've tried Viva and you haven't been able to get an answer as quickly as you'd like, or if you haven't tried Viva and you just want to call our customer service team first, whether it's a claim question, a prescription question, a billing question, anything, we are a provider question. We can help you. So it's nice. You have two layers of customer service when you're in this program. You have Viva and you have Iron ReHealth. So that's a really nice feature as well. Probably the biggest benefit to the program is the rate stability that we provide. If groups are fortunate enough to, I guess, to qualify to get into the program based on their risk, then they're going to see more stable benefits over time. We underwrite every single group, which is a little different than what the small groups. And when I say small, that's any employer that's in the 2 to 50 space. Right now, they're in a small group plan. They get rated. Doesn't matter how good their claims history is. Doesn't matter how bad their claims history is. None of that is taken into account if they're say with Blue Cross or United Health or whoever that is right now. But in our program, we underwrite every single group. So we right up front, after we go through the process of getting information to give a quote, we assess a risk assessment to that group, and either the group can benefit from that, or they might be better off in the program where they are now. But groups that do benefit from that, they see a nice rate advantage compared to where they currently are, and they get in our program and they have access to these other benefits. And we've been seeing typical groups have been seeing rates anywhere from, we've had some rate declines for groups that they've gone down. We've got groups that are in their third year in the program now that are seeing rate decreases. We've seen groups that have rate holds, and we've seen groups that have 2 to 3% rate increases. And that's in our program, about 2 to 3% is a standard rate increase. When you compare that to the small group plans that they've traditionally been in the state of Alabama with another large carrier, they're typically seeing rate increases from 5 to 10% for small groups. Now, groups that are 51 employees and larger see even larger increase. We've seen increases on those type groups up to 20%. So that's one really nice feature about this program, is you can get in this program and you might get a 2% increase with us, where you might have gotten an 8% in the other carriers program. And you do that over a number of years, and it really makes a difference in what you are paying now, what you would have been paying in that program. And you'll see on this page, we've got 4 different plan types to choose from. And one thing that's really unique is you can choose up to 4 plans. So right now, a lot of groups that are in that 2 to 50 employee space that have a group plan, they typically have one plan that they can choose from. Some of them are offered 2, but most of the time it's 1. But in our program, they can choose from any of the 4. So, and as we add additional plans, they will be able to choose from those as well. So right now we've got these 4. And the platinum, gold, and silver plans are similar to the Blue Cross small group metallics. When our program started in 2018, we mimicked the silver, gold, and platinum metallic plans that Blue was using. So let's take, for instance, that silver plan. That is the most popular small group plan in the 2 to 50 space. And in our program, as you can clearly see, that deductible is $2,600, the individual deductible. Well, the Blue Cross Metallic plan has since gone up from this point in 2018 when we mimicked the plan. I think in 2021, that plan is now at a $4,000 deductible for individuals. So when you're comparing this silver plan that you're currently looking at with the one you have through another certain carrier, that this plan is much richer. Our copays have not gone up. We've not made a single change to the silver, gold, or platinum plan in 3 years. So as another carrier has gone up on the deductibles and out of pockets, we have kept ours the same. So when you're looking at our silver compared to their silver, and then we have a much richer plan. So we've got those 3 plans. We've also got the Wellness 5000 plan. That's a high deductible plan. That's been a popular plan with some of the agents we work with because they like to pair a secondary product with it, but it's been popular because it's a lower cost plan. It does have a higher deductible, but it's popular with younger employees, or it's a good option for lower waged employees that want some benefits but might not necessarily be able to uh, afford the rate for silver, gold, or platinum at this time. It's also been a popular benefit when certain employer groups have decided, hey, we want to contribute 100% of, say, the wellness, or 100% of silver, and then the employee themselves can choose if they want to upgrade to silver, gold, platinum, or whatever it may be. But that's one huge benefit. I mean, we have the 4 plans, and if you had a 20 employee group that wanted them, 5 could choose platinum, 5 gold, 5 silver, and 5 wellness. So there's no additional administrative fee, no matter how many plans you want to offer. But it's nice to have options, because currently a lot of groups in that 2 to 50 space, they just don't get these kind of options that we're offering. The employer can decide what they want to contribute. If they don't have the ability to contribute anything right now towards coverage, they can just offer the coverage to their employees and let the employees pay 100% out of pocket. We've talked with members that have told us they feel like just by offering benefits, even if they can't contribute anything, just by offering the benefits, they see a nice advantage when they're trying to recruit employees or retain employees, because it allows them at least to tell employees, hey, we have a group benefit plan that you can be a part of, or we have a 401k that you can be a part of. Whereas a similar business down the road, if they're not offering those 2 options, then they might be a little behind the one who is offering it. So the employer can decide what they want to contribute, what dollar amount they want to contribute. One nice thing we can do is, as well, we can roll deductibles. So like right now, we're already into the new year. Deductibles reset for every plan that you're on, regardless of the carrier. They reset on January 1st of each year. So one thing we do, we have groups. So a lot of people hearing about this program might be hearing about it for the first time today. And you might say, well, my renewal was in January, so I'll have to wait, or my renewal was October, so I'll have to wait. But that's not necessarily true. You don't have to do that. You can roll over at any time. Like we've got groups right now that I was working with earlier this morning that are coming on February the 1st. That's not necessarily their renewal date, but that's when they're coming into our program. And if they have a small group now, and they've already used some of the deductible in January, we just got to get a simple report from that group, and we can credit a deductible. So if, say for instance, if we had a group that was going to come on in October of any given year, they had used 9 months worth of deductible to that point. Well, we just got to get a simple report, and we credit them those deductibles so they don't lose them. So that's another nice benefit about the program. We also have, and actually you don't have to share this, but we also have dental and vision plans that go along with the health plans. You can get health only. You don't have to get dental and vision, but we also have those available as well. As far as the quoting process, it is, I think it's fairly easy. I think you will find it fairly easy as well. We can quote groups, whether you currently have a group plan or if you do currently have a group plan. I mean, a lot of the groups that transition into our program are currently on a group plan, whether it's through Cigna or Blue Cross or United Health or whoever, but they currently have coverage, and then they want to get a quote just to see how we look rate wise and network wise compared to where they currently are. So it doesn't matter if you have a group or not. We can provide you with a quote. The chamber has some marketing material that when they send out, there is a clickable link on that material that can get you started by there's an interest form link that gets you started. It supplies us just with a small amount of information to contact you to tell you, hey, this is what we need to get your group started. But it's just very basic information. The quoting process takes, if it's a smaller group, the 2 to 50 space, it takes, I don't know, 1 or 2 or 3 days to get you a quote back. So it comes back relatively quickly. And at that point, we can answer any questions you have as far as network or, looking up providers for you. Like I've said, we've got, every hospital in the state is included. I know that's always a big question for people about the hospital. So every one of those are included. So we got that, kind of out of the way, but we can look up anything we need, regardless of whatever question you have for network or whoever, to make sure your docs are in coverage. But we go through the process, and then there's a few more steps, but we typically like to get groups. If, say, right now we're working on February groups and we have a cutoff just at the end of this week or the first of next week. So kind of the 15th of the month is when we kind of cut groups off for the following month. But the process is very easy. The billing process is very easy. The invoice process is very easy. The changes that, whether you come on the program and you want to subtract an employee because they left your business, or you want to add a new one, or you want to order additional cards, all those things can be done online just with one click of the mouse. And that's something that we'll lead you through. But that's, I think, a kind of brief overview, as brief as I can get. So if we have any questions, we can open that up to questions now. I've actually, I think I saw where there's a chat below. I haven't been able to read it, but I think there's maybe a couple questions.
If you have 2 employees, one being a W-2 employee and one being the owner and does not receive W-2, will they qualify?
Yeah, the owner does qualify as an employee. So yes, that group would count as 2.
Okay. So far, that's the only question I've got. Some people might be trying to, maybe I could pull up the dental plan. I don't know if people have questions about that. But the link to all these is in the chat again, if anybody needs it, and it's on our website. So if anybody else has any questions, I can always pass them along to Marty. If you just want to think about it for a little bit, maybe share it around your business, talk it out with your partners. And yes, that's just the dental and vision plan offerings.
Yeah, that's right. And they're both open networks. So what that means is basically you can go see any dentist or optometrist that you want. The rates are on the side there, but we've actually got a partnership with Iron ReHealth does with the Alabama Dental Association. So a lot of those dentists, we've had that partnership since the very beginning. So a lot of those dentists are either on the benefit program, or they've seen the marketing material, or they've sent in for a quote. So a lot of them are familiar with us now. When you put down an Iron Re, dental card, they know exactly what it is. So those are both open networks. If you can go see whoever you want there. We've got some more detailed information on that. The minimum size for vision is 4. We do not have a minimum for dental. And like I mentioned earlier, if you decide, if you have 8 employees moving forward with health coverage, if 2 of those employees want dental, that's fine. If none of them want dental, that's fine. If they want vision, we need 4 or more. And we also have situations where you might have the 8 employees that want health coverage, and you might have an additional employee who doesn't want health, but they might want dental. So that's fine as well. So we can kind of mix and match to meet your company's needs. But we've got a little more in-depth flyer for both of these if someone needs more information on these as well.
Great. Well, good deal. As far as I know, there aren't any more questions. So I guess if I do receive any after this, feel free to email them to me at Ashley J. It's ASHLEE, and the letter J at calhounchamber.com, and I will get those to Marty to get answered for you.
Thank you, Ashley. Thank you, everybody, for joining in.
Yes, thank you for joining us today. We're going to have our next Business Toolkit webinar series next month around this time. So we'll have more details closer to time. But I just want to thank everybody for joining us today. Marty, again, thank you so much. If you guys ever need anything, just let us know.